All right, welcome back. Welcome back to all of you to the Now Morning Show here on a CTT. We are coming from home, and it seems as if so is the minister. Minister, good morning to you, and thank you so much for joining us.
Good morning, Natalie, and good morning to all the viewers of TTT. Happy Monday morning to you.
Yes. Minister, you know, I have to say that I was not surprised on Saturday when a state of emergency was announced. What is kind of upsetting is that even after the announcement of a state of emergency, there are still people out there jackassing the scene. What are we going to do, Minister, so that they can get the message? Is it that we just need enforcement? Is it that we need to put heftier fines on the regulations?
Okay, so at this point in time, if I can speak directly to all 1.4 million citizens, look, in this fight, even with or without a state of emergency, as CMO and I have been saying, pretend that the person next to you has COVID. Pretend that everyone around you has COVID and just adjust your behavior. All of us, don't wait for the Prime Minister, the Minister of Health, the CMO, the doctors to lead this fight. Every person is a general, is a soldier in this fight against COVID-19. And with that comes a heightened degree of personal responsibility. We all have a role to play as your own general, as a head of a household, as a soldier in this fight. We all, at this point in time, have to have a mixture of personal responsibility. And yes, you are right, the police are going to have to be very, very firm with the restrictions.
But, I am wondering, because I think that obviously, since last year, January, we saw you as Minister of Health make the appeal for, avoid unnecessary travel, non-essential travel. We still had people who went on cruises. We still had people who went to Carnival in Miami and all over. The government put the healthcare measures in place and say, okay, this is how people are going to come home. People still try to defy that. We see every single step of the way and the measures that have been put in. There have been a good amount of people who are ignoring it. So I think that obviously the messaging itself is not enough because it's been consistent. It has been consistent. Is there any thought to making the fines for the breach of the regulations more hefty so that hopefully it will act as a deterrent?
So that's a discussion that we always have, because this being a moving target, we always reevaluate where we are. And those are discussions, we look at every measure and see, what could we do, what could we do, what could we do? So we have reached the stage of a state of emergency, and we are hoping that this measure will really reinforce in people the need to stay home. Look, last year, you would have been hard-pressed to find somebody who knew someone with COVID. A year later, I am sure if you ask anybody, they know somebody who has died from COVID. And that's the reality. And this non-adherence to public health measures, Natalie, is not unique to Trinidad and Tobago. It's a human condition. All countries around the world, CARICOM, United States, England, they have had the same problem, because you are asking people to do something which runs against their nature as human beings being a social creature. We are social creatures. And to ask people for a 1-in-100-year event to simply snap your fingers and change the behavior, it did happen to a certain extent last year, December, January, March, but then people got tired. Pandemic fatigue is a reality around the world. And from March to now, people just pretended that this COVID didn't exist. But the reality is, it is there. It is no respect of office, race, creed, or religion. So at this point in time, to protect Trinidad and Tobago, we always said it's about lives and livelihoods. Now it's about lives. Now it's about lives. Your life, my life. So everyone needs to work with the government, social distancing, wearing your mask, washing your hands, staying away from crowds and congregations of all types. Even inviting people into your home now is a risk to your life. Stay
But
home, stay safe.
Minister, how well do you think that message is getting to the people? Because we announced the state of emergency on Saturday, but people were lambing in Chaguaramas. Right before the state of emergency, we had the hikers going out. Yesterday, we had people, trying to have prayer group because somehow I don't know what their logic is for all of these different groups of people. But the reality is, regardless of the measures that the government have put in place, there are still people who are flouting the regulations, and it's not without consequences. The consequences are what we heard from Dr. Mariam Abdul Richards. Touch and go with the parallel healthcare system.
Correct. Yeah.
St. That just opened at 85%, Hoover at 74%, Arima at 90%. So the reality is we are in a dire situation, and yet people continue to flout the regulation.
Yeah. So if we break up the population, the vast majority of people are conforming. But in a pandemic with an infectious disease, it's that minority that we have to continue talking to, appealing to, and now it has brought us a state of emergency. It means you have to have enforcement. So that minority, it just takes one. Remember, there are sparks of COVID all over. And when that minority does not adhere to the public health measures, it pours gasoline on a spark. That spark becomes a flame. That flame becomes an inferno. And that is the message we have to keep giving out to people. Don't be that spark, and you gather, whether it's in Lopino, Chaguaramas, to pray in public, that pours gasoline on that spark. That spark turns into a flame. That flame burns down the entire place. So the vast majority of people are adhering, but we have to keep on talking to that minority. And hopefully the SOE and the powers that the police will have to disperse you and move you. Now you can't exercise outdoors in public. You can exercise outdoors at your home. Hopefully this is going to give us some breathing room.
And I do believe that it will give us the breathing room. But what happens when that state of emergency?
After, that's the thing that keeps me up at night. I always ask myself, what happens after? When we get this breathing room, and we will get some breathing room by the end of this week, because the measures we took, not the SOE, the measures we took 2 weeks ago, you will see the fruit of that this week, hopefully with decreasing numbers, decreasing hospitalization rates. And then with the SOE coming in on Saturday, 2 weeks from now, 3 weeks from now, you will see the positive effects from that. And that's the 25-cent question, because you can't go on like this forever. The question is, how will the population respond after? From a health perspective, my solution to this is vaccinating our way out of this, right? And that has to be a part of the solution. So you have vaccinations coming in moderate quantities. We are in talks with companies to bring it in commercial quantities. All things being equal, I have said publicly, I can achieve herd immunity in this country in about 7 months, depending on a predictable commercial supply of vaccines and the uptake of vaccines by the population. So within the next couple of months, you should be seeing a significant rise in the number of people either with your first dose vaccination or second dose, which will give us even more breathing room going forward.
Right. And I think some people have missed the messaging about, how the vaccination works. I think once more, just for reinforcement, because people have been messaging me to ask, they've been trying ad nauseum to get vaccinated and can't. And I keep saying to them that we're on pause now because you have to save enough of the AstraZeneca vaccine to get the second dose.
Yes.
So please, once more, Minister, explain to them how the vaccination works.
Sure. So all of the vaccines so far approved by WHO, with the exception of Johnson & Johnson, which is a single-dose vaccine, all the others are 2-dose vaccines. So the 2 will be used in Trinidad, AstraZeneca, and from later on this week, Sinopharm are 2-dose vaccines. The first shot will give you a certain degree of efficacy, about 70 to 80%. The second shot takes you up into the 90s, which is where you want to be. So We want to make sure that as many persons as possible are fully immunized, that is, with their second shot. So we have vaccinated about 60,000 people so far with first shot of AstraZeneca. We have reserved another 60,000 already in country for those people. So those 60,000 will be fully vaccinated. We get in 100,000 of Sinopharm, all things being equal, late Tuesday night, sometime into Wednesday morning. We could start vaccinating by around Saturday. 100,000 doses, 2-dose vaccine means I could vaccinate 50,000 people in the first instance, and then reserve 50,000 doses for their second shot. So the objective is by the middle of July, between AstraZeneca and Sinopharm, I will have in this country 60,000 AstraZeneca, 50,000 Sinopharm. That's 110,000 persons, which is not a small number. 110,000 persons fully vaccinated. And that is the program going forward now to vaccinate ourselves out of this pandemic. So that even though you have those minority behaving in a way contrary to what we want, once we vaccinate enough people, the persons who are getting ill don't need to go to a hospital. Let me make a last point here. Vaccination does not mean you cannot contract COVID. What it does, it makes it harder for you to contract COVID. And two, most importantly, if you do contract COVID with what is called breakthrough infections, you will not get seriously ill. You may not even know you have it. You don't need to go to a hospital, a HDU, a ICU, and mortality rates drop.
Mm-hmm. And another question that I've been getting is how does the Ministry of Health treat with someone who has died from COVID? People still seem to be uncertain about what the process is for putting the body to rest.
So depending on the particular religion you belong to and the way you dispose of bodies, Hindus, as you know, cremate. Muslims, as you know, bury. Christians do a combination of interment, cremation. We sent out guidelines since early last year to all RHAs, all funeral homes, all religious bodies as to how funeral homes, the RHAs, and members of the public who unfortunately have lost a loved one, how they could respectfully dispose of their loved one bodies, either by cremation on the banks of a river, in the case of Hindus, cremation in crematoriums, interment, burial in the case of Muslims and Christians. So there are very good protocols that the funeral homes adhere to.
Right. Are there certain funeral homes that are treating with COVID patients, or just any funeral home or all?
I think that is something I will have to touch base with the RHAs, because the RHAs and the members of the family will contact the particular funeral homes. I don't have those exact details, and I don't want to talk how to turn on that one.
No, I understand that. So, Minister, Saturday, Sunday, Monday, day 2 of the state of emergency. And as I said already, we're seeing people just doing what they want to do without fear or favor, probably no malice or ill will, just as you said, in limers. But, I'm just trying to figure out, how do we get that message out? That's okay. You're a limer, no problem. But what is going to cost the country is far greater than what you could ever imagine. It's not even just the healthcare system. It's what you're going to be able to enjoy in terms of social services 2, 3, 4, 5 years from now.
Correct.
It's the kind of education and what cuts we're going to have to make, because the economy is going to take a lot of work to rebuild an economy that has been damaged by COVID. So do you think that kind of appeal to say to them, all right, forget the health. Obviously, you don't know anybody who's died from COVID. You don't care who died, but your child who may benefit now from GATE will not be able to benefit 5 years down the road, or, we're going to have to get rid of free health care, because the thing is, it's going to take so much out of us that we're not going to be able to afford these things. Do you think that kind of messaging will work for these people who continuously flout the regulations?
Well, at this point in time, obviously the messaging didn't work for that minority of people, obviously. So at this point in time with the SOE, unfortunately, they will have to feel the full brunt of the law. But the police can't be everywhere at the same time, right? But I must commend the police for doing an excellent job under great strain, the same way healthcare workers are under great stress. Let's not stress out our frontline workers. Our nurses and doctors are under tremendous mental and physical strain. And let me this morning shout out to all the healthcare workers again. Natalie, I know we appreciate healthcare workers, but as minister, when I go into these COVID facilities and I talk to nurses and doctors, and I see the dedication and love they have for what they do, but I hear their disappointment in how they are being put at risk by the minority. I am asking people, for the sake of healthcare workers, for the sake of the police, for the sake of the army, for the sake of all frontline workers, do your part. Recommit to do your part as we did it in December, January, February. Just do your little part for a couple of months. Stay home, social distance, wear your mask. Don't line, don't congregate. Don't bring the virus home and infect auntie and infect grandma. Because you see, that 20 to 49 age group is the one that is driving it in the Paho region, which Dr. Etienne, Dr. Wheeler, myself have been talking about, is that Lyman crowd, that social crowd. But now you are seeing that they are now becoming casualties of war because more and more younger people are dying. So I am hoping that message will get through to them that, look, this is no longer a virus you bring home and only your grandmother dies. Now you can die. So you have a stake in this fight. You are a general, you're a soldier in this fight too.
Do you think that, I don't even think honestly that the fear of death is working, Minister, because the thing is that they're still liming. If that had happened, then what we would have seen is maybe people going to the supermarkets, people going to the malls, but that's not what we're seeing. We're seeing people literally going out and try to lime, right? So I'm saying that the messaging to, safeguard the healthcare worker isn't working, to safeguard the police, the service, or frontline workers. But I think if the government is to say to them, that child that you have there will not get gate in 5 years, that might, because Trinis have a culture of entitlement. And the entitlement comes from the fact that the governments over the years have always tried to help them wherever they can with whatever aspect of their life, whether it's education, health, social services. So I think if that is threatened, because I keep sitting and thinking to myself, what will make these people just wake up and stop playing the fool, And I think that, I know for me, I don't like anybody messing with my money, and I don't like anybody messing with my family either, And if I had a child and I was to hear that this child would be robbed of an opportunity, it would make me stop and think. So is there going to be any thought given to the messaging, to changing the message? Because we have the frontline workers, some of them have died, and it still hasn't stopped these people.
Police have died, policemen have died. I mean, So Natalie, you are spot on. When I used to teach marketing, I used to tell my marketing students, everybody listens to one particular radio station, WIIFM. You ever heard about that radio station, WIIFM?
No.
What's in it for me? WIIFM. What's in it for me? So people always have a difficulty putting aside their individual circumstance for a greater good. That's human nature. So you are spot on that we need to maybe encapsulate in the messaging what you will lose a year from now, even though we have been saying it. But you are spot on, and I take your guidance very, very seriously. WIIFM, I'll give you a term there. You can use it, but you have to pay me royalties.
All right, I'll definitely pay the royalties. Minister, we're almost out of time, but just remind us when the Sinopharm vaccine is supposed to get here, when we can start vaccinating with the Sinopharm.
Sure. So all things being equal, the Sinopharm vaccines, to the best of my knowledge, have already left Beijing. They are en route to Trinidad. Suppose they will have a couple stops. They're not coming straight from Beijing to here. All things being equal, whether, moving from one plane to another, one airport to another, crew changeovers, all those things, all things being equal, they should be here sometime late tomorrow night, which is Tuesday night. It means by Wednesday, in the wee hours of Wednesday morning, it will be in our warehouses. Wednesday,
that people can start making appointments again as of tomorrow.
All right. I'll come into that. Yeah. And then we start to package and distribute to all the mass vaccination sites and the health centers. That could be completed by Friday, so we can start to vaccinate by Saturday. We will make the announcement at Wednesday's press conference as to when you could actually start to make your appointments. Who can make appointments? Persons over 60 with or without comorbidities. So you have a 62-year-old healthy person, they can make an appointment. You have a 64-year-old diabetic, they can make an appointment. And also persons under 60, so you have a 50-year-old diabetic, they can make an appointment. So persons under 60 with comorbidities. So let's talk some distribution. We are getting 100,000 doses. 50,000 doses will be given out. You have to reserve 50,000. Some will go to Tobago. Some are being reserved for the persons in long stay homes. All right. Some are being reserved for those frontline healthcare workers who didn't get a bite last time, and then the balance to the general population. So we urge persons, when we make the announcement on Wednesday's press conference as to when you could start to make your appointments, where, and so on, that will be given out at Wednesday's press conference.
All right, Minister, we have to leave it there, but thank you so much for sharing with us this morning.
Thank you, Natalie, and good morning to you.
Yes.